Good morning and welcome to today's press conference. Bienvenue à cette conférence de presse. I'm Mia Rabson with the Canadian Press and I'll be moderating today. We're going to start with about 15 minutes of speaking and then we will have time for questions starting in the room and then we'll go to Zoom. And we will start with Allan Thompson, the program head at the Journalism School at Carleton University.
Good morning. My name is Allan Thompson. I'm the head of Carleton University's journalism program. I'd like to begin by noting that we are speaking to you today from the unceded territory of the Algonquin people. It's a pleasure to be here to help launch the Taking Care report, a first-of-its-kind national study on mental health, well-being, and trauma among Canadian journalists and media workers. The project that has produced this groundbreaking research is led by Carleton journalism professor Matthew Pearson and veteran journalist Dave Seglins. It's appropriate that this work has been situated in a journalism school because we urgently need to take on board its lessons and incorporate them into what we do at Carleton. We need journalists in Canada to be mentally well. When they aren't well, they need adequate support that is free of stigma. We need journalists at their best so that they can properly serve Canadians and fulfill their duties as watchdogs that hold governments, corporations, and the powerful to account. Notably, we are holding this event here on Parliament Hill, a place where so many journalists have been exposed to trauma and harassment in recent years, from the shooting in 2014 that killed Corporal Nathan Cirillo to this winter's self-described Freedom Convoy. Joining us virtually is Cliff Lonsdale of the Canadian Journalism Forum on Violence and Trauma, as well as Brent Jolly and Fatima Sayed of the Canadian Association of Journalists. They'll be online and available to answer questions after the presentation. Alberta Senator Paula Simons, who was a longtime political reporter and columnist in Alberta, is also joining us remotely and is the sponsor of today's event. Here to tell us more are Matthew Pearson and Dave Seglins, who led the Taking Care survey last fall and produced today's report. Matthew.
Thank you, Allan. I am currently an assistant professor of journalism at Carleton University. Previously, I had stints at a weekly newspaper in Smithers, British Columbia, the Ottawa Citizen, and CBC's Parliamentary Bureau. I was named the Michener-Deakin Fellow in Journalism Education in 2017 to create a new teaching module to help journalism students better understand and report on trauma and the people touched by it. And it was in that capacity that I first met Dave Seglins. While I admired Dave's work as a journalist, I was particularly impressed by the courage he showed in speaking out about his own difficult struggle with PTSD following a particularly challenging assignment.
Thanks, Matthew. I'm very pleased to be here as well. I'm a proud journalist. I'm a proud CBC journalist. I was actually recently named at CBC as a journalist and well-being champion. But this work of the Taking Care report began in 2020, before I wore that hat at CBC. So today I am speaking to you not on behalf of CBC, but more personally as a journalist and a mental health advocate within our industry.
Thanks, Dave. The Taking Care survey was born out of a series of conversations between Dave and I that began in the fall of 2020. Researchers from around the world have studied journalists, but there had never been a large-scale study of journalists and media workers in Canada, so we set out to do that. We knew, anecdotally and from our own experiences, that the news industry in Canada wasn't very good at talking about its feelings. We knew a stiff upper lip mentality prevailed in many newsrooms. We knew some colleagues felt ashamed about struggling to deal with the aftermath of a difficult story, while others felt sidelined after speaking up about their challenges. But there was no data, nothing concrete we could point to as a benchmark, so we set out to collect some. Our goal was to hear from journalists and media workers employed in every province and territory, from national media outlets and small weeklies, as full-time employees, contractors, or freelancers. We wanted to hear from frontline storytellers and those working in a variety of other news gathering and production capacities, which is why you'll hear us use the terms journalists and media workers interchangeably. We received 1,251 unique responses to our survey, and more than 900 people answered every single question, and more than 300 people wrote in additional comments, many of which are included in the report. Here's what we wanted to know. How has the COVID-19 pandemic affected media workers? How frequently are they being assigned to cover stories that expose them to trauma? How does that coverage affect their mental health and well-being? How often do they drink alcohol or consume other substances? Do they get enough sleep or exercise? How are journalists affected by the harassment and violence they encounter online, in the field, and in their own newsrooms? What kind of training on trauma reporting have media workers received at journalism school or on the job? And how can Canada's broader journalism ecosystem, from national media outlets to smaller digital startups, to labor unions, J schools, professional associations, and other media stakeholders, prioritize and protect media workers' health and well-being in this industry? Our findings confirm our worst fears and suspicions about our industry. The onus is now on all of us, from the front lines to newsroom leaders, executives, and journalism educators, to grasp the gravity of this situation and meaningfully address it to reduce the harms Canadian media workers are suffering on the job. We will now outline some of our findings.
The news industry is incredibly exciting, but it's also built on stress, deadlines, the race to be first, competition. We cover the world's tragedies, catastrophes, human suffering, and we think today deeply about the victims and the journalists covering the story unfolding in Texas, and the weeks before that, the mass shooting in Buffalo, and for weeks and months now, the war in Ukraine as examples. Covering these kinds of stories isn't new. What is new, though, is over the past decade or so, is how we do our work. The technology, the rapid acceleration, the volume of information, the demands and pressures. Add to that a global pandemic. Add to that reckonings with racism, Canada's history of colonialism and genocide of Indigenous peoples and culture. We don't just cover these stories, we also live them. And then there's the rise of social media trolling, political polarization, anger directed at the so-called fake news, growing hate and harassment that has been targeting mainstream media, online and in the field. And then on top of all of that, there's a crisis in some of the economic models of news media, leading to layoffs and job insecurity. All of this is having a profound impact on the health of people who work in the news industry, the watchdogs of our democracy. We heard overwhelmingly from 1,200 Taking Care survey respondents that stress is worse than ever. More than half of us, 57%, are having difficulty managing. There are a lot of numbers in this report. We're not going to read them all here, but we do want to share key highlights. Matthew?
Thank you, Dave. We have slides for those in the room, and I understand that the press gallery has or will send them to people joining us on Zoom. COVID has made a challenging job even harder. Add to our daily mix a deadly virus, social isolation, challenges for work-life balance, and contract work drying up. 82% of media workers worked from home during the pandemic. Others, however, essential workers, continue to work in the field or newsroom, facing risk of infection and illness, new workloads, and challenges given the massive disruption. We heard that COVID conditions worsen stress, particularly among women, people under 50, Black, Asian, and Indigenous workers, and those who have frontline job roles, such as editorial and production assistants, podcasters, researchers, hosts and presenters, photographers, video journalists, and producers and associate producers. Harassment has also worsened during COVID. As the messenger, the media became a greater target for people fed up or challenging pandemic restrictions and lockdowns. We found more than half of media workers, 56%, faced online harassment in the last 4 years. 35% were harassed in the field. People were targeted most simply for being members of the media. Other targets, the content of stories, women, a media worker's race, harassment was more prevalent among media workers who are Black, Arab, South Asian, and Filipino, and among people more visible out in the field or with greater public profile, hosts, reporters, video journalists, and photographers.
We asked about media workers' overall health and well-being, and they told us media workers have much higher rates of anxiety and depression than average Canadians. 69% report they struggle with anxiety, 46% report depression. So then we asked, well, have you been formally diagnosed? 28% have been diagnosed with anxiety, 21% diagnosed with depression. This is far, far higher than the general population. We also asked about alcohol and drugs. How much do you drink? How often? How often do you drink a lot? These questions were based on a well-established screening tool used to help identify people with problem drinking. 46% of media workers score as high-risk drinkers, almost double the Canadian average. And exposure to terrible events, death, suffering, it's all part of the job, but many media workers suffer harm as a consequence. Like other professions, police, fire, ambulance, media workers routinely cover stories involving trauma, but seldom with appropriate support, planning, or debriefing. We examined the kinds of stories that journalists routinely cover and the frequency, and we found that media workers are repeatedly exposed to a steady diet of potentially traumatic stories involving, for example, sexual assault, murder, life-threatening injury, and racist attacks. Our exposure rates are so far above average that 42% of media workers have covered most, if not all, of the lists that are included, or of events that are included on a list that involve trauma on something called the Life Events Checklist. This is used by professional healthcare workers to screen people for PTSD. 42% of media workers have covered most, if not all, of those kinds of events. And these trauma stories are having a profound impact on people's health. People report high rates of burnout, anxiety, inability to sleep, anger, nightmares. 1 in 10 told us they have had suicidal thoughts stemming from traumatic stories they've worked on over the past 4 years. The culture of the news industry and the lack of time make managing stress and trauma extremely difficult. One reporter told us, quote, "What I have some trouble reconciling is that trauma and exposure to trauma is part of the job, which means it can't be escaped. It needs to be managed. There is so little meaningful acknowledgement of the impact this job has. An email noting that a story was difficult and well done is nice, but it isn't proactive time off or genuine inquiry about well-being. Obviously, part of the issue is that you don't want to be seen as weak or unable to do a job that requires the ability to deal with trauma and keep going." Respondents told us repeatedly that sucking it up is how most news professionals deal with it, and that talking about the difficulties can be a career killer, viewed as weakness. Taking breaks, taking time off is difficult, saying no to difficult assignments is extremely hard. Repeatedly, we heard complaints that news leaders lack expertise, lack understanding, and lack time to check in on employees and to prioritize their well-being. The irony, or the flip side of all of this, is that most media workers love their jobs. 50% of respondents rank their job satisfaction as good or excellent. Add to that another 30% say it's fair. But all of this comes at a very high cost. As mentioned, high rates of anxiety and depression. More than half, 53% of us, have sought professional medical help to deal with work-related stress or mental health issues. Even more pronounced among those under the age of 40. 28% of all respondents report having taken a prescription drug for work-related stress or mental health. And then there's access to health care, which is a big issue. Freelancers have no employer-paid benefits. Some large news organizations offer generous coverage for unlimited psychological counseling, but the majority cap coverage at between $500 to $1,000 a year. However, usually only full-time employees get those benefits, not the legions of contract or casual workers. One national news service covers $300 per year for psychological counseling. That's enough to cover about a session and a half. Many large employers offer employee assistance plans, EAPs, but those usually offer some free counseling, but many respondents report that there are long delays accessing that help. And when they do get to see someone, often the counselors that are on hand have little clue about the realities of work in the news business. While 35% of managers say they have received some training on trauma and mental health, the vast majority of our respondents to the Taking Care survey have not. They've not received the training at work nor at journalism schools. We need to get better. We need to get better at talking about mental health on the job, better at preventing harm before it happens, to prevent burnout, anxiety, and PTSD, and we need to get better at supporting colleagues when they're struggling.
Thanks, Dave. We know these are big problems. They require culture change, and we know it won't happen overnight. But here are 9 recommendations to help us create a more sustainable and sustaining news industry in Canada. Our first recommendation: news organizations need post-pandemic plans that are flexible and acknowledge the stress and disruption of the last 2 years. We need to expand training and education to create literacy around mental health and well-being across the industry, from J schools to frontline staff to newsroom leaders.
Number 3, newsrooms need in-house well-being champions and expertise in supporting mental health. We need to fix the suck-it-up work culture and help employees achieve better work-life balance. We need new approaches to assignment and checking in on our people to prioritize and protect mental health.
The industry should rethink its relationship with alcohol, including within the workplace, as gifts, or at work-related celebrations. We need peer support programs within newsrooms and across the industry to help one another discuss and survive the challenges of our business.
Number 8, we need more coverage for mental health counseling, and this coverage must be extended to all employees, including those who work part-time, casual, contract, or on a freelance basis. And finally, newsrooms should seek employee input to identify gaps and listen and assess what's really needed to support well-being.
Thanks, Dave. Before we take questions, we would like to acknowledge a few folks who have supported this project. Dr. Anthony Feinstein served as an advisor to us and contributed to the report's section on moral injury. He is a world leader on the study of journalists and trauma. Our Carleton University graduate research assistants, Erica Ibrahim, Cassandra Yanez-Layton, and Tracy Lindeman, have all been top-notch. They have each put in a lot of hours into this project. We thank the Canadian Press for providing images for our report. We are indebted to the journalists and media workers from across Canada who took part in the survey. And finally, we'd like to thank Cliff Lonsdale and Jane Hawkes at the Canadian Journalism Forum on Violence and Trauma. They have been steadfast partners and unsung heroes fighting to improve health and safety in Canadian journalism for 15 years. A reminder that Cliff is on this call this morning and can take questions, as are the representatives from the Canadian Association of Journalists, Brent Jolly, and Fatima Sayed. Thank you.
We'd be happy to take questions.
Okay, we'll start with questions in the room. Tom Korski from Blacklock's Reporter.
Ms. Rabson, how many questions are we allotted? I don't know who's on the phone.
You're going to get one question and one follow, and if there's time,
We're sticking to 2. Okay. I want to clarify, Professor Pearson, that this has nothing to do with self-serving consultations by the Department of Canadian Heritage to censor or regulate legal but hurtful internet content. Because there have been some subsidized media organizations, Mr. Seglins' employer is one of them, who have circled around that theme that we need somehow federal censorship of social media because it hurts people's feelings. I want to ensure that I'm not going to hear about this from the Department of Canadian Heritage. Am I? This has nothing to do with regulation of the internet, does it?
No.
My second question, can you name the last editor who was assassinated in Canada?
No.
Isn't it interesting that you don't know that? But you did a survey on harms and stress in our industry. It was terracing hair, by the way. It was 25 years ago. You should have put that in your study. Thank you.
Thank you.
Okay, we will go to Zoom now, and we'll start with Adina from the Canadian Press. Adina, are you there? Hold on.
She may be muted.
Oh, there you go.
Hi there. Can you hear me okay? Yes. Hi. Are you with me?
Yeah, go ahead, Adina.
Okay, great. Sorry about that. So, you alluded to some of the harassment that journalists face online and in the field. I'm wondering if you asked at all about the harassment that journalists face in the workplace. I'm thinking about the recent allegations that Jennifer Valentine made against one of her coworkers. I was wondering if you asked at all about harassment that journalists face in the workplace, and as well as gender-based discrimination in the workplace.
We did. It wasn't the prime focus of the survey, but certainly we asked about harassment in those three spaces: online, in the field, and within the newsroom. We found that more than a quarter of taking care respondents had experienced harassment or threats inside their workplace. I'm aware of the stories that you're talking about the current allegations of harassment at Toronto radio stations and broadcasters. I don't know the specifics, and I'm not going to comment on them, but what I will say is that as part of the suck it up culture within news about keeping our heads down and just getting our work done, there has been a lot of respondents who've commented on toxic workplaces and the feeling by many that they are unable to speak up and be heard when they're expressing concerns about their well-being, their psychological safety, and indeed harassment in the workplace.
Do you have any recommendations? Oh, sorry.
No, go ahead. I was just asking you to do your follow.
Do you have any recommendations about how we address this kind of harassment that takes place between journalists in the workplace?
I do, but I think there needs to be a culture shift within our news industry, is my view. And that culture shift is about prioritizing employee well-being so that we're comfortable talking about the things that go on in our workplaces, and we can talk about things that are negatively affecting us, and we can respond to them in proactive ways. That's going to sound very abstract to the allegations that I know you're speaking about. But the truth of the matter is, until we change the culture and until we raise literacy among all of us, from the frontline employees to our supervisors, to the managers and executives, until we're all thinking about and feel comfortable talking about mental health and safety and well-being in the workplace, then we're going to continue to have pockets of employees who feel they can't speak up when they have issues that are negatively affecting them, whether it's in the forms of alleged harassment or whether it's burnout or anxiety or depression. So ultimately, training and education, literacy, and moving towards a culture that prioritizes not just getting our facts right, not just being first in the news, but also making sure that our people are doing our jobs in a sustainable, healthy way.
If I might add, we made a recommendation to establish protocols to protect health. And under that, we specified that protocols and policies that address the higher rates of harassment, stress, PTSD, and other issues among women in particular. And some of these strategies could involve flexible work hours, on-site childcare, private childcare benefits, signage promoting dedicated help for women who may be experiencing domestic violence, and in the case of what you're raising, reminders in the Office of Harassment Protocols and how to access support.
If there's any other journalists online who want to ask a question, can you use the raise hand function to let me know that you would like to ask a question? Just giving them a couple seconds here to... Oh, okay. Teresa Boyle from the Toronto Star. Go ahead.
Hi. What would you recommend that a journalist do if she's not afraid to talk about these issues, and if she does raise them and say that she's having trouble with overwork and stress and bullying in the office, but nothing happens, even though she raises this again and again? Like, what do you do?
That's a great question. Going to your supervisor, if not your supervisor, your supervisor's supervisor, if you have union representation, or if you have recourse through courts, through human rights tribunals, those are options. I don't know. But I ultimately think that education and more open discussion, I know this sounds like a very long-term lofty goal, but raising literacy at all levels where we can all start to talk about it more comfortably and prioritize well-being is the thing that is going to get rid of some of the dysfunction and the toxicity that we hear about from many of the respondents in the report. I don't know if that's a satisfying answer for you, but.
I would add to that. I hope that the existence of this report helps start some of those conversations, particularly in newsrooms where there has been some reticence to have those conversations. I think we have now brought together data from more than 900 journalists across Canada who answered every question in the survey, more than 1,200 who touched the survey at some point. So we have a lot of data, and I hope that I hope that this report is being read today and in the coming days by news leaders and executives across the country. And I hope that they will reflect on how their news operations are run and the ways in which that they might change. I think, Dave and I have been clear in the report that this is not only a management issue. Everyone in the industry, from the front lines to assignment to newsroom managers to corporate executives to unions and other media associations, all have a role to play in the culture change that Dave is speaking about.
If I may, I want to pick up on it again because another thought occurs to me around this. When I began my work within CBC, I was very concerned that there was going to be resistance, and I actually found quite the opposite. I have felt very supported by my employer in carrying forward work around well-being, developing training, opening discussion. There is an eagerness at all levels for better, healthier discussions around well-being and mental health. What is really lacking is expertise. One of the things that I have grown to realize is that most of the supervisors and senior leadership in news organizations, they were former journalists. They grew up in the suck-it-up culture. They excelled as journalists, but they didn't get into the business to manage people. They didn't get into the business to manage stress and mental health and well-being. So they're not experts. They need help. They need training. They need support, and they do need understanding. They are in charge of legions of people, but they may not have the tools. And so I see this as being very much a industry-wide issue to develop the conversation, the expertise. So I just add to that because I'm very, I've reflected a great deal on, if management could just fix the problem. Well, management needs help doing that, and it also needs frontline people willing to engage with management in a constructive dialogue toward this culture change.
Okay, I'll ask one more time. If there's any other questions on the line, just use the raise hand function. Adina, do you have another question? I'm not sure if you just didn't put your hand down or not. Okay, I think Teresa, I think, do you have another question?
Yeah, I just wanted to follow up. Dave, you mentioned that you're a well-being champion at CBC, and I think your report calls for the creation of more well-being champions. how do you do that? Like, how do you make that happen in the newsroom?
In my case, I pitched it, and it was an invented job. But what I saw in my own workplace and I see elsewhere is a bit of a vacuum. I'm a frontline employee. I'm a frontline journalist, and this was important. I started pitching it. I started talking to my bosses, and they thought it was a good idea that we develop some training, and they allowed me to develop, and so I began to develop a little bit of expertise. And then I pitched a job. How can I do this as a working journalist while also doing some of this training and development, building peer support within CBC, working on projects that will help raise the literacy? I pitched it. And I was fortunate enough to have CBC as an employer that sees the value in this. And so I'm now kind of evangelizing and suggesting that if we can get more frontline journalists and other news organizations across the country to become invested in this larger project, ask your bosses for an opportunity to take some training courses, ask your bosses for chances to build these supports in. It can be led by employees too. It's not just a management solution or a management problem.
I would add to that, in news organizations globally that we have looked at, the BBC, ABC Australia, NPR, Reuters, Al Jazeera, those are all organizations that news organizations in Canada could reach out to for leadership, direction, advice on how to create sort of in-house expertise in this field.
Do you have another question, Teresa?
No, thank you.
Okay, this will conclude today's press conference. Oh, okay, sorry. Yes, I see that now. Cliff Lonsdale would like to respond. Hold on, Cliff. You just have to unmute yourself.
Yes,
There we
thank you. Sorry. I'm probably the oldest journalist on this call by quite some distance. And I'm one of those who was once a news manager. And I really want to the few industries where you become a manager without any training to manage people. And you do what your predecessor did. And one of the reasons why we started the forum was we wanted to stop that vicious circle. And the second thing I want to say is that there has been quite a lot of progress. There's a big problem still. But, you couldn't get anybody to talk about this at all 15 years ago when we started doing this. And I think this report is just fantastic because it is going to be a catalyst to move this discussion forward. And the basis on which it will move forward best is we can do better journalism if journalists feel better about the way they're doing it. And that's really important for our society at this time. And I think it's a real wake-up call.
Thank you. That'll conclude today's press conference. Thank you.
Thank you. Thank you very much.
Thank you.